Hey guys, this is Dr. Moore here, and we are going to be doing a little lab review on AP1 bone stuff. And I'm going to go right off this list right here that every student in AP1 should have. We're going to go right through the list, go through one by one. We're going to start with the skull, and as we get to the limbs, we're going to talk about which is right and left. So we're going to jump right in to save time, make these videos not too long, and we're going to go with the skull first. Okay, we're going to start just by identifying bones. Okay, and easy way to remember bones is that these are the actual proper names of the bone, which are going to be separated by sutures. And all the bones we're using, we should just mention, are not real bones, so we don't have every suture present, but we have the big ones. Okay, so right now we're just going over bone names, and in a few minutes we'll go over landmarks, which are going to be structures on the bones. Okay, so first off, we're going to talk about cranial bones. Okay, easy way to remember the cranial bones is that the cranial bones are going to be basically on top of the skull, and we're going to start with the frontal bone, okay, which is in front. It's pretty easy to remember that. Frontal bone here, which is also part of your forehead, separated here by a suture, which is not on the list. Okay, it is the coronal suture though. Then we have two parietal bones, a pair of parietal bones here, and of course there's a suture in the middle, the sagittal suture, again not on the list, but I'll go ahead and show you that. Our posterior cranial bone is occipital bone, okay, and then we have cranial bone on either side, another pair of bones, and this would be temporal bone over here. The temporal bone is going to extend way out here to about the middle, it's kind of hard to see, but about the middle of the zygomatic arch. And then of course you'd have another temporal bone on the other side. So another temporal bone over here. Again, there's a suture that would run along here which we don't see. You just kind of have to pretend it's there. And so the temporal bone again is going to run about to the middle of the zygomatic arch. And then we have some cranial bones on the inside. So I'm going to open up here and show you the sphenoid bone, which is going to be the bone which is basically shaped like a butterfly. So this bone, basically right in the middle of the skull, is the sphenoid bone. Okay, and that includes this here. And then we have, last but not least, for the cranial bones, the ethmoid, and this is going to be the ethmoid, right where I'm putting my finger. That's the best place to see the ethmoid. Now the bone to either side is still frontal, so you got to have to picture how the frontal is going to kind of come up like that. But this again is ethmoid, just that little piece, and you can see there's a blue dot there to kind of help you see that that would be ethmoid. Now, facial bones, we'll jump to the facial bones, and again, most of the facial bones are just going to cover the face, so again, that's easy to remember. Starting off with the facial bones, we're going to go over this bone here, which obviously the upper row of teeth embed in, and that's the maxilla. Okay, then we're going to show you the palatine bone here, which is basically the posterior part of the palate. I've drawn in a suture just to let you visualize. Again, that's the palatine bone. Now, if you're wondering what bone this is, it's still part of the hard palate. That is also maxilla. So again, we've got maxilla here, and we have maxilla here, and we have palatine behind or posterior to the suture. Okay, next is the zygomatic bones. One thing to remember about the zygomatic bones is they're your cheekbones. So these would be zygomatic bones. If you look closely, there is a suture right here. So the zygomatics basically from about here, there's a little suture here, to here. So it's basically what makes up the cheekbone. So obviously there's a zygomatic on the right. There's also a zygomatic on the left. Then next we have the lacrimal bone. Easy way to find the lacrimal bone is simply to grab on either side of the nose here. Kind of like some people do, if they grab a right, kind of on either side of the eyes, and grab that area right there, that's the lacrimal bone. It is the smallest bone. If I show you up close here, this encompasses the lacrimal bone. There is a little suture here to show you. It's a very, very small bone, and there's a hole right in the center of it. We'll come back to that hole to discuss what that is. But this is the lacrimal bone on the right, and this is going to be the lacrimal bone here on the left. Okay. Next is the nasal bones, which are the bones of the nose. Hard to see again, there's a little suture right down the middle, so there is theoretically a right and left nasal bone. Okay, you can notice the nasal bone is short because the majority of your nose is cartilage. Okay, then we're going to show you the vomer, and the vomer is technically the inferior part. Maybe I'll show you this way. It's technically the inferior part of this bony nasal septum. Most students just realize it's the majority of the bony nasal septum. Technically, it's not the upper part, which would encompass part of that ethmoid bone, but we're just going to pretty much remember that majority of this bony nasal septum inside here is the vomer. Okay, again, if you want to see it from another angle, here again, let me find it here. Here where my finger is, this is the vomer. Okay, so you can take a good look at that. Last but not least, we have one more official facial bone, and it is called the inferior nasal concha. And I'm going to show you here by hooking my pen underneath it. It's really called a turbinate bone, but are little bony hooks inside the nasal cavity. There's one on the right, which I'm under, and there's one on the left. You're going to notice there's another set above that. Those are called the middle nasal concha. We'll talk about those in a little bit. But we're showing you the inferior right now because it is a true facial bone. Okay, and then last but not least, we have the final facial bone, which is the mandible. Okay, we're going to do the mandible here separately, but realize it is a bone. By the way, it's the only freely movable bone of the skull. So if we jump now briefly to the mandible, I'm going to just talk about the mandible for a minute, and then we'll jump back to the skull. So we'll get the mandible out of the way here. So on the mandible, we'll just quickly go over the structures. So real quick, you need to understand the three regions of the mandible. Okay, so the main region we call the body, which is going to be this region here. So basically the anterior, the largest region of the mandible, we call the body. Okay. We call where the bend is the angle. Okay, so this region here would be the angle. And this region here that basically runs superior, this is the ramus. Okay? And so we'll talk next about the notch. We call this large notch right here, my pen sits, the mandibular notch. Okay? And we've got a couple foramen here. So we call this the mental foramen, either side. Okay, foramen are usually holes for arteries and veins and nerves. Mandibular foramen is on the inner side here, inside of the mandible. Again, the mandibular foramen. We have a little protuberance here. Okay, bump if you want to call it that. We call that the mental protuberance. Maybe easy to remember because mental protuberance is between mental foramen. Okay, and then we have some processes. So we have the, we'll talk about this one first. We call this the coronoid process. Again, I'll say it, coronoid process. So these two processes here, these are basically for muscle attachments. Okay. Then we have the mandibular condyle right here. This is what would be in the joint surface. Anytime you see the word condyle, you should realize that it's a smooth, rounded joint surface. Okay, so a smooth, rounded bone, put another way, inside a joint. So it would make up the joint surface anytime we have a condyle. So this is the mandibular condyle, and therefore it would have to, if I bring my skull back in here, it would make sense that it would have to, because there's a condyle there, it would have to be part of the TMJ, the temporomandibular joint. So you can see that makes up part of the joint. So that's the mandibular condyle. It's just the surface here. If we're talking about this bone below it, this process, we call that the mandibular process. Okay, so there's different terms for it. You could also call it the condyloid process, probably better because it's on your list. The book also calls it condylar process. So there's many other names for it, but the list says condyloid process, so we'll go with that. So again, condyloid process. So real quick review, because this can be a little confusing. This is the coronoid process. This is the mandibular condyle, just the top of it here. And then this is the condyloid process. So that's everything you need to know for the mandible. Not bad at all. Okay, so then we jump back to the skull. And what we're going to do now, we've already done the cranial bones, right, which are primarily these bones on top. We've already done the facial bones, okay, right here. And then what we're going to do now is we're going to do landmarks. So these are structures, could be holes, could be processes, right? Again, we call holes foramen. Could be, any number of things, but they're going to be on the individual facial or cranial bones. So let's go over the landmarks here. So the first one we're going to talk about is the biggest hole, easy one to remember. We call this hole here the Foramen Magnum. Okay. Some other holes to be familiar with here is going to be the Carotid Canal. So my pen, it's kind of hard to see, but my pen is in the Carotid Canal. So I'm going to move it out of the way here. There we go again. I'll stick it in there. Find it. There is the Carotid Canal. Okay. Posterior to that is the Jugular Foramen. Okay. Again, the Jugular Foramen, if you look, I'll kind of hold it like this here. The Jugular Foramen is a larger hole, or larger foramen. Okay. And so now we'll kind of flip. So notice that was the underside or inferior side of the skull. So we're going to flip here, look inside, and we're going to look back at this ethmoid bone. So the ethmoid bone has two structures on it. Okay. Actually, if we want to get real specific, right where the blue dot is here, we have this bone that basically splits this structure in half, and this bone's called the crista galli. Okay? And if you look on either side, there's a little valley, and this valley is called the cribriform plate. Okay, so in the middle, crista galli, on either side, the cribriform plate. Okay? Also looking inside, we jump now to the sphenoid bone, and we'll look at the middle of it here. This is, right where my finger is, the sella turcica. It's basically that hole, that depression. Called the sella turcica, and it's actually where the pituitary gland sits. And around the sella turcica, we have some structures. Okay, we have what we call clinoid processes, and actually, this would be the anterior clinoid processes. These little processes that are quite prominent. These 2 points would be posterior clinoid processes, and basically where the red dot would be the middle clinoid process. Okay, so anterior, posterior, and middle clinoid processes. Okay, go back to the inferior side, we look at the pterygoid plates. Okay, you've got a medial and a lateral pterygoid plate. Again, over here, medial, lateral, pterygoid plate. Okay, then we go to the mastoid process, which is going to be next. These large processes here, again for muscle attachments, these are the mastoid processes. Okay, now the next one is going to be the mandibular fossa, which is going to be right where my fingers are, and I'll point to it here at the pen. This is the mandibular fossa. Anytime you see the word fossa, you think depression. Typically, not 100%, but typically it's a depression. Okay? Processes, again, as you're noticing, are structures that basically stick out. Fossas typically are structures that are depressions. Foramen, as you're noticing, like the either carotid canal, which is a canal, or the jugular foramen, basically holes. So moving along, we'll talk about the zygomatic arch. Okay, we pointed this out earlier. This is zygomatic arch. Okay. One key thing to realize is right in here somewhere there is a suture. Again, we don't really see it. We could kind of draw it in. Okay, so we'll make a suture. Make this easier. We talked about the temporal bone being part of this bone here. And you say, well, what is this other part of bone here? Well, this would be the zygomatic bone. Okay, so the whole thing we would call the zygomatic arch. Not real accurate because this is the temporal bone, but we call the whole thing the zygomatic arch. So what we're going to do is we're going to be a little bit more specific, which is what you want to know, we're going to break it up into two separate parts. We said this is the temporal bone, okay? And we're going to call this section here, notice it's posterior to the suture, we're going to call this section the zygomatic process. So an easy way to remember this is, whatever bone it is, it's the opposite bone's process. So again, it's the zygomatic process of the temporal bone. Therefore, that would make this side the temporal process of the zygomatic bone. A little tricky on the wording, but that's going to be important to know. So again, put it another way. We know this is the zygomatic bone. We talked about it already. Therefore, this little piece of bone here has to be the temporal process. We know this is the temporal bone. We talked about it earlier. That makes this bone, this little piece of bone here, the zygomatic process. Okay? Probably one of the trickier things, but it's all wording. Okay? Go to a little easier process here. These two prominent processes are styloid processes. Okay? Then we go to the concha again. We've already shown you, I'll show you again. We have the inferior nasal concha. If I can hook my pen there. Right above it, we have the middle nasal concha, right above it. The superior nasal concha is not going to be visualized. That's why it's not on the list. So then we go to the auditory meatus. Okay? This is our external auditory meatus. And what is it? It's basically your ear canal. So there it is there. External auditory meatus. Okay, so sound waves go in, make their way all the way into the inner ear. And then what we're going to see on the inside here, you can see this little hole here is the internal auditory meatus. Okay, what's going to come out of this hole is not sound waves now. What's going to come out of this hole is the nerve headed to the brain, cranial nerve 8, which would be vestibulocochlear nerve. Okay, so that is the internal auditory meatus. Okay, then we have some fissures that are going to be important to know. I'm going to try to point inside here as best I can, but we have the superior orbital fissure. I'm going to kind of point toward the camera here. This is the superior orbital fissure. Fissure means crack, so that's what it is. It's basically a crack. If I point like this, you can see the inferior orbital fissure. Maybe I'll put it like that for you. Okay, again, it's an inferior crack. And of course, orbital fissure, it simply means it's in the orbit. This hole we call the orbit. Okay? So one other small hole, it's difficult to see. Maybe I'll point to it from here. It's called the optic foramen. Okay? Optic foramen. You can also see it inside the orbit, but it's going to be kind of difficult. Maybe I'll just point for the camera. You can look inside there. Maybe you'll see it, maybe not. But that's called the optic foramen. It's basically a foramen for the optic nerve. Okay. Book also refers to as optic canal, and that would be correct too. Okay. So then, jump back. Let's go to sphenoid next. So we're going to go back to the sphenoid bone, talk about the wings here. So you can see where the yellow dots are. We call these the lesser wings. And right below that, we have this section of the sphenoid, we call it the greater wing. So up top, this little ridge is the lesser wing of the sphenoid. Below it, greater wing of the sphenoid bone. Okay, we go back to the lacrimal bone, and if you remember, the easiest way to find the lacrimal bone is just kind of grab on either side of the nose here. So if you look at the lacrimal bone, you'll see that hole that we mentioned earlier. That hole is called the lacrimal fossa. And yes, it is considered a fossa, even though it's a hole. It's called the lacrimal fossa. Okay, so that's one of those exceptions to the rule. Most fossas are depressions. This one's a hole. Okay. Then we go to some foramen in the middle of the sphenoid. Okay, and these foramen, 3 in a row. We'll make sure we get where you can visualize them. So I'm going to start with this posterior one. It's a tiny little hole. The tip of the pen barely fits in. It's called the Foramen Spinosum. Okay, notice it's the posterior most hole. If I go to the one just anterior to it, we call that the foramen ovale. If you look closely, it is oval. That's why it's called foramen ovale. It literally means oval hole. And last but not least, we have this more round hole, which is going to be a little tricky to see here, but it's right up here. That's the foramen rotundum. Foramen rotundum. I'll point to it again. Yes, it's hard to see on this one, but it's right there. Foramen rotundum. Those are tricky to see, but if you remember the order from posterior to anterior, it's Foramen Spinosum, Foramen ovale, Foramen rotundum. Okay. Then we look finally, only two more to go. This is the inferior side again of the skull. We have the occipital condyles. Again, I said anytime you hear the word condyle, you should think or realize that it's part of the joint space. So this is going to ultimately make up the joint between the occipital bone, okay, and the atlas, the first cervical vertebrae. So this is the occipital condyle, okay? You have one on the other side as well. And then right posterior to it are the occipital, the condylar canals. So right behind the occipital condyles are the condylar canals. Should be a canal, but in this case, it's just kind of a depression, but it should be a canal. Condylar canal. Okay, and so those are all the structures for the skull. That's definitely the biggest section of the lab. And we'll break and do some more in a minute.